Awesome. So, as I mentioned, tonight we're focusing on the online Masters in Public Health program with UC Berkeley School of Public Health. My name is Elise Rudolph. I use she, her pronouns, and I am the Director of Online Recruitment and Admissions. I'm also joined by my wonderful colleague, Stephanie Nguyen. Would you like to introduce yourself?
Yes, thank you so much for being here, everyone. I serve as the Online Education Recruitment Manager, which essentially means that I'm here to support you with learning more about the program and assisting you throughout the application journey. So be sure to book an appointment with me at the end of the session.
Awesome. Thank you. So, Stephanie and I, we are here to support you throughout the admissions process, everything from sort of learning more about who we are as the online MPH program, to the application process, to what happens if you are admitted to the program. Our goal is to make that a transparent and straightforward process and to help you put your best foot forward. So, definitely use us, take advantage of any resources we're offering, book that appointment with Stephanie. We are here to help. And we're also very excited tonight to be joined by Dr. Brent Fulton. Dr. Fulton is a faculty member here at the School of Public Health and one of the professors that specifically teaches in our online MPH program as well as the on campus program. In our online MPH program, Brent teaches health economics. And Brent's research examines how markets and regulation can improve the delivery of healthcare, including its cost, quality, and access. In addition, he is developing public-private financing strategies that will provide funding for social drivers of health for families with children residing in low-income communities. Thank you so much for joining us, Brent. We're excited to hear more from you.
Yes, hi everyone, and that's me there. The same person. I just have a little more gray hair now. So I've been part of the online MPH faculty since its inception in 2012. So I'm excited that you're all here, that you're interested in learning more about our online MPH program. And then specifically, I'm the health policy and management faculty lead. So later in the presentation, I will go over the HPM curriculum and some of the courses that you would take if you join us.
Awesome. Thank you so much, Brent. And yes, thank you for mentioning that you are the faculty lead for our HPM concentration. And as you may have noticed, that is one of the key pieces of content that we want to talk with you more about tonight. So here's an overview of our agenda. Stephanie and I are going to begin by just sharing a little bit of the high level overview of the online MPH program. And then we'll hand things over to Brent to talk more about the health policy and management concentration. We'll wrap things up by going over cost and the admissions process. And then, as I mentioned, we'll make time for Q&A. All right. So the first thing we'll cover is our mission. So here at the UC Berkeley School of Public Health, our mission is healthy people locally and globally. There is a lot of text on this slide, but primarily what I want to share here is that offering the Masters in Public Health program in an online modality is very much a mission aligned project for the School of Public Health. So we really believe that you don't necessarily have to relocate to the Bay Area to get this high quality education. We believe that you staying in the careers that you're in, staying in the communities that you're already a part of, is achieving this mission of creating healthy people locally and globally. So we want to make sure this top tier UC Berkeley education is accessible to folks both here in the Bay Area who might be working or balancing other responsibilities to those who live in other states and even other countries. And again, we really believe in this idea of extending Berkeley's reach and improving population health where you're at in real time. All right, so why choose Berkeley? Now there are definitely a lot more online MPH programs, but we still believe that UC Berkeley is the best. Obviously, we're a little bit biased, but I want to share some of the key reasons we think Berkeley is a standout program. So, obviously, you may be familiar with UC Berkeley's reputation for academic excellence. And I also want to add that our online MPH program has a proven track record. As Brent mentioned, we have been around for 14 years. So we are not new to this. We weren't like a new COVID program that popped up. We have been around doing online education for quite some time. We are actually UC Berkeley's first fully online program. So we're really proud of that. We feel that we've really honed in on how to do online education well. And we believe that we're bringing that academic excellence that UC Berkeley is known for into this program. So we offer the same program that we offer on campus is the same as the online program. It's the same curriculum. Many of the faculty are the same, as Brent being one of those folks who teaches in both our on-campus and online programs. So really, this is UC Berkeley staff, faculty who created this program, who are delivering this program. We don't outsource any aspect of this. It truly is a UC Berkeley homegrown endeavor. So we're really proud of that. We also have a reputation for innovation and impact. I mean, you can look at the extensive list of important research that faculty and students from our school have produced and how they've contributed to the field of public health and that knowledge base. But something I really like to share and highlight is that new to the School of Public Health is actually our social impact program that we have. So part of that is a social impact innovation grant. They do social impact Tuesdays, which are like skills development opportunities that all of our students can take part in. The social impact innovation grant is something that our online students can apply for and an opportunity to participate in a real world project. So we really believe in again, giving you skills to make high impact in real time. Personal and professional growth. This is also something we really believe in. Most of our online students are in the workforce or looking to, newly joining the workforce. And so we understand that you might be looking to leverage this degree to make your next step, to get a promotion. And part of our wraparound support is something called our RISE team. We'll talk more about them in a moment, but essentially we offer a lot of professional development. We'll help with your job hunt. We'll help with interview skills, resume building, all of those things. And that's just built into this program. Also, our school has over 18,000 person alumni network. So as a student in our program, you get access to that massive alumni network. We definitely have a lot of students in our program who've made really valuable connections through that. Curricular flexibility, we will also talk more about this later on, but something that we really believe in is making the program work for you. I've mentioned this a few times, but a lot of our students are working full time. You might be balancing caregiving responsibilities. And so we work with you individually to make a plan for how you're going to complete the program, ensuring that you have the tools you need to be successful in the program. And we have a lot of staff on board who are there to help you along the way, as well as your faculty advisors. There's a lot of room to specialize in our program. We have 41 different courses that you can choose from, 4 different concentrations, HPM being one of those. And we have a few certificate opportunities as well, which we can talk more about. And then the last is our commitment to health equity. This is something that's so part of who we are at Berkeley and what we really believe in. This is definitely woven into all of the curriculum throughout our program. And with that, I'm going to hand things over to Stephanie to dig into the program overview.
Thank you so much. And thank you for highlighting some of my favorite points about the program. With the program overview, what I want to talk about is what the format looks like. So 90% of our online program is taught in an asynchronous format. and I'll get into the details in just a bit. It's a 7 semester program, so it runs year long, and we also have 2 campus visits that happen annually, and those are required. They're embedded into your program format. So the type of degree that a student would receive is a professional MPH program. It's very skills-based and really helpful towards your training within the field of public health. So the degree does not indicate that the program was completed online. You get a formal degree, and it will state that it's that you've completed it here through UC Berkeley and earned your Master of Public Health. The course delivery within our program, lecture materials are typically provided, as I mentioned, in an asynchronous format, so it's not live. There are going to be some classes that may integrate some synchronous sessions, but for the most part, your online coursework is usually offered with weekly deadlines. Though the office hours are held in real time, Brent can speak to more about this a little bit later on how his courses run if you guys are interested. The course model. So incoming first year students are typically required to complete 6 pre-assigned core and breadth classes. The best way, one of our students actually shared with us recently, is it feels like an enhanced general introduction to public health. So it's giving you the opportunity to explore. It's on a fixed schedule. So we have pre-designed the first year for you to help you figure out what courses you need to take. And as you introduce yourself to the second year, this is where you're going to focus more on your concentration courses, your elective courses. So we got a lot of good information coming in the next few couple of slides. So the student support services, we are a homegrown team, as Elise mentioned. You have program managers to help you with logistics. They work directly with faculty leads such as Brent or Dr. Fulton to support you with course mapping, professional development. We have all sorts of support for you throughout your journey within the program. You are paired with a program manager that is specific to your concentration of interest, and together they will just support you throughout the academic journey. The average time commitment within the program is typically 15 to 17 hours per week, as it is a part-time program. So it's really made for those that have a schedule that needs a little bit of a balance. And the average units enrolled per semester are 6 units. So that essentially you're taking 2 classes each term or semester. The units required to graduate is a minimum of 42, and our capstone is actually a comprehensive exam. So it's an open book style. It's an opportunity for you to learn, to reflect and test your knowledge on everything that you've learned throughout the program. Before I move into the next slide, Brent, is there anything else that you would like to share?
Yes, I think one other aspect of our program that we try to build in is community. So when we first designed the online MPH, we realized people are distant. How are we going to build community? And we do this in 2 ways. The first way is each course has some type of group project that you'll be involved with. And typically that project will run either the entire 8 weeks or the 16 weeks of the course or for a greater part of it. So you really uh, build community among your classmates. And then the second way is everybody comes for a summer visit. And I know Elise and stuff here go, oh, you got it right here. Okay, good timing. So they'll talk about the summer visit.
Yeah, so thank you so much for leading us into this space here. This is actually one of our favorite parts of the year. This is something that is prepared and planned by faculty along with the student services team. So as a part of this online MPH experience, as much as we love the online space, we also value that in-person connection. It's a great way to build your network and really meet your peers that you've been working on group projects with and getting to know throughout your first year. So as mentioned here, you are required to attend 2 summer campus visits, and this happens during your first year and once again in your second year. Each visit would last probably around a week, I would say, so anywhere between 5 to 7 days, and takes place here at Berkeley, California, at the School of Public Health. So it's a really great opportunity for you to just really immerse yourself in this experience. It's a conference style experience, so it's really designed to help you build with your cohort and your classmates. It's an opportunity for you to take advantage of the lectures, the classrooms, and we just to give you more of an idea of what happens is we have built-in activities, we have community activities, we have networking sessions, advising sessions, and really unique coursework related back to the summer visits. So they are mandatory as they are graded each day. And moving along, the fall program timeline. So this we do have two intakes, spring and fall. So this that you see here is just the fall example. Um, as I mentioned, it's a 7 semester term. So students are initially taking 2 classes in their program, unless there is any changes to your schedule, which I will speak about in a moment. But looking at the first row, as you can see here, students are always enrolled in a minimum of 2 classes, and you are enrolled in 6 units each semester, all the way through until you complete the program and um, finish and graduate. The blue icons essentially mean that your classes are going to be stacked in those semesters, and the rest of the terms are going to be taken consecutively, so one after the other. But again, you're always enrolled in a total of 6 units, and you're always taking a minimum of 2 classes. It's just that the best way I can explain this is your first 2 terms, we recognize that you are an incoming student. You may be pursuing graduate school for the first time. You may be returning, years after, and we really want you to immerse yourself in the experience. So we pace it a little bit differently so you have a better time transitioning into the program. And as you get deeper into the program, once you hit that summer term, the courses are more specialized. So that way it gives you the opportunity to lock yourself into those classes and bring that back into your work and the ways that you may see fit. And as I mentioned, your schedule can look different. So being that we're a pretty flexible program, some students may take interest in increasing their workload and completing in 2 years. So that's the earliest that you can accelerate the program. If that is the case, in your second year, where you see the shaded gray terms here, you may take 3 classes with approval of your student services team. And if so, you can finish in 2 years. Otherwise, sometimes things happen. We have some students that are active duty members. We have students that have a change of pace in their professional life. Whatever the case may be, we also can work with you to have a different pathway to complete the program in uh, 3 years. You can have up to 5 years if you needed to. That is something that we can work with you on a case-by-case situation. So this just gives you an example, but I would say majority of students do tend to complete the program in 27 months, which is our traditional format. I'll pass this back to Elise to give some insight about the RISE office.
Awesome. Thanks, Emily. So, yeah, I mentioned this earlier, but part of our program includes career and professional development. One of the ways that our RISE team will support you is some of the things I already talked about. So, career planning, interview prep, supporting you with your resume, things like that. Another key way that they will support our online students is through guiding you in your practicum. Part of our program includes a 130-hour practicum project. This is an applied practice element of our program where you get to use some of the tools that you're learning in the classroom and apply them to a real-world project. And our RISE team provides wraparound support in helping you identify your practicum project, where you'll complete your practicum, helping you stay on track to complete that. So we have a dedicated team of folks who are there to assist you throughout that experience as well. And then they also assist with leadership development. So they can really help you with leadership skills. They often will host specific events. They'll bring in lecture guest speakers and host different sort of networking events as well. So they're really just an excellent resource that all of our students get to take advantage of while they're in the program. All right. And with that, we'd love to hand things over to Brent to talk a little bit more about the HPM concentration.
Well, thank you, Elise. So we're going to start with a poll. I want to try to gauge your interest in health policy and management. And there's no right answer because, I'm not on commission. What we want to do is place you into the best fit. So whether it's health policy and management, Stephanie mentioned we also have other concentrations. There's epidemiology and biostatistics. There's food, nutrition, and population health. And then we also have an interdisciplinary tract where you don't have to choose a specific concentration. So this will help me better assess your interest. So can everybody see the poll?
Yeah, we have some folks
Okay,
participating.
good. All
Yes.
right. So yeah, tell us if you currently work in HPM, want to gain more depth.
I see folks answering a high number of D and A. It's actually mixed. We have some A's, some B's.
Okay, so some in health policy, healthcare policy, some in management, and then some are okay, D, yeah, exploring a career change to HPM. Okay,
Yep,
that's always good as well.
about
Because
78%.
78% are D.
Hmm.
Okay, good. D's good here, not for your grades in a course, but here it's totally fine. All right, so she's showing it. Okay. So about 80% not in exploring a career change. So that happens uh I don't want to see the word a lot, but it definitely happens with our students that they're coming in, they want to gain an MPH to pivot careers. So it's definitely common. And some I would say are an A or B and they want to gain more depth. So this is interesting. Okay, so we have want more exposure. So the I wanted to show you two slides about where our students who are in HPM traditionally either are coming from or going to. So there's healthcare organizations across the spectrum. You have the insurance companies, hospital systems, physician organizations, pharma, medical device, but then you also have consulting firms, you have nonprofits, you also have people working in government, including public health organizations, because the skills that we teach you in health policy and management are really relevant to wherever you land. So next slide, please. So we're in a school of public health. So our mission is public health, but teaching those skills that are applicable to public health areas as well as the healthcare system. So if you think of public health, these are upstream of the healthcare system, oftentimes the social drivers of health. What is the environment, air quality, water quality, climate change? Then you also are looking at medical interventions that affect healthcare, so vaccines. And so, what public health tries to do is assess what are the contributors to disease and injury, develop policies, and then assure that those policies are being implemented and do reassessments and so forth. So this wheel diagram are 10 essential public health services that you're going to see across your courses, learning about these, and then specifically in health policy and management. So the next slide goes into what our courses concentrate on. So we're really a skills-based program. So if you look at whether it's management, that encompasses strategy, organizations, finance, or economics, or policy, which incorporates methods, advocacy, also innovation policy. What we try to do is teach you skills in those courses. So you're going to have a lot of case studies, a lot of applied group assignments or individual assignments. You open up spreadsheets when you're working in finance to do budgeting, calculate net present values and things like this. And so we see this then as being very relevant to wherever you end up once you graduate. So next slide. So we're an online course, but you're not taught by bots. You're taught by real people. Who knows, 5 years from now, it's probably going to change or it'll be a hybrid. But no, we have real people here that are teaching you. And I want to start here with the introduction to health policy and management. So that's taught by Professor Brown. And that's one of those core courses you take during your first year, and you take that in the summer. And then once you take that course, then that is the prerequisite to the other health policy and management courses. And now we have 8 of them that are elective. So over on the left side are our health management courses. And so you can actually earn a certificate in health management if you complete healthcare strategy, healthcare organizations, and finance, because we feel that these courses really equip you to be in a managerial role, to assess organization strategy, teamwork within your org class, and budgeting and finance in the healthcare finance class. Then the economics curriculum, there's 2 courses. So I teach health economics. So this is essentially healthcare economics of the healthcare system, what's working well in our healthcare system when it comes to healthcare markets and financing. Where do markets break down? And what are public policy interventions to try to help mitigate those market failures? And then Will Dow teaches the economics of population health. So these are looking upstream at the social drivers of health. And he uses cost benefit analysis, cost effectiveness analysis to see where our investments upstream going to be most productive. And then we have 3 health policy courses that you can choose from biomedical innovation to health policy methods. That's going through the process of policy analysis, trying to choose the right policies under different criteria, and then health policy advocacy. That course was just started in our program in this past fall. It was very popular given the current environment with a lot of changes at the federal and state levels. So that is our overall curriculum. So let me go to the next slide. And what I wanted to show you on this one is where does it fit into your overall curriculum? And so those first year courses are in that top row. Those are your breadth courses. And then the health policy and management courses that you have the health management certificate courses. Those are the 3, the economics courses, the health policy, and then you'll have electives to choose from. You'll have 3 additional courses, and we listed some of the ones that are most often chosen by HPM, but you can choose from all of our electives. We have 41 of them. Next slide. And this is an important part of health policy and management, but our overall curriculum. You can be part of the HPM concentration. We'd love that, but you can also just take 1 or 2 HPM elective courses. You can just take the health management certificate, strategy, organizations, and finance, or you can go on and do the entire concentration where you pick up another econ course as well as a health policy course. And so we have a lot of flexibility, and you can change midstream. You could sign up. I'm going to do HPM. I'm all gung ho on the concentration. You get in and you have a greater interest in your EPI course that you took your first year, and that exposure really caused you to want to gravitate there. So we have a lot of flexibility in the program. You got to plan, though, with myself and the program manager, Zoe Blaylock, because courses are offered at different times. And so you want to structure your schedule. So if you want to meet the HPM concentration requirements, it's easy to do, but it does take some planning. Next slide. And so finally, the competencies that you're going to learn through the HPM curriculum, you have management competencies, finance, policy, and economics. And as I said at the beginning, it's a skills-based curriculum that it's very applied. You're going to learn some theory, but the skills that you're going to learn are going to be applicable to your work environment, and even if it's a career pivot to where you're going to pivot into. So I will turn it back over. Is it you, Elise?
It's me. Thank you.
Okay, great.
Awesome. Well, thank you so much, Brent. I'm going to talk a little bit about some logistics. We want to be transparent about costs associated with attendance. We know this is a huge component of planning your grad school journey. Right now, our program fees are $1,629 per unit. And again, this is a 42 unit program completed over that 27 months or 7 semesters. So you're paying for the number of units you're taking that semester, usually about 6 units per term. We can answer any questions about that as well. In addition to that, there are a couple Berkeley campus fees, and sometimes we're asked, why are there campus fees if I'm an online student? And so what I like to share is that you are first and foremost a UC Berkeley student. You get access to all sorts of UC Berkeley campus resources, like our library resources, even the financial aid office, tutoring services, things like that, and your campus fee goes toward those resources that you get access to. And of course, if you happen to be local to the Bay Area, you can take advantage of any sort of on-campus amenities as well. There's something called the Student Health Insurance Plan, or SHIP. It's very common for our students to opt out of SHIP, and you have the opportunity to do that if you have health insurance through your employer or another source. So many of our students do choose to waive SHIP. There's a document management fee and our instructional resilience enhancement fee. This goes toward ensuring that our curriculum is up to date, that all of our online modules are accessible and current, and making sure that you're getting an excellent online learning experience. So that brings the total cost of our program to just around $75,000, excluding SHIP. How are students paying for this? So there's definitely a few ways that our students have approached funding their degrees. One option is, of course, being self-funded. So a benefit of us being an online part-time program is that you can work full-time while you're going to school. And some folks are able to self-fund the program because they're working full-time. If you choose to self-fund, you may be interested in applying for the fee payment plan, which would break your semester payments into 5 monthly installments. Many of our students take advantage of federal student aid. If you are unsure if you want to use federal aid, or you're thinking about it, or you are sure, in any case, we highly encourage you to fill out FAFSA. It's just a great place to start, understand what you qualify for, what you're eligible for, and many of our students do opt to take out student loans that way. If you take out student loans, many students are able to convert a portion of those loans into work study, and there are opportunities to work on campus. We just hired an OOM student, through work study, so it's definitely an option as well. There may be options for folks to pursue public service loan forgiveness. Again, if you're someone pursuing the federal student aid route, definitely look into this. Sometimes these options change, so we encourage you to check out that link and see if you might happen to work for a nonprofit or a government agency that's eligible. One thing we encourage everyone to check out as well is, if you are employed, check if your employer offers to any tuition sponsorship. So a number of our students are taking advantage of tuition reimbursement through their employers. It might be spelled out in a benefits package, or it might be something you even have the opportunity to request, especially if you're able to show how the degree aligns with your company's goals. So definitely check out if your employer offers any sort of sponsorship. External funding. We encourage folks to check out ASPPH's fellowships page. It's a great resource that collects all sorts of nationwide scholarships related to the field of public health. So definitely explore what's available locally, nationally. If there are any professional organizations or affinity groups that you're part of, check out if they offer fellowships, things like that. And then we do offer a scholarship internally as well called the Dean's Health Equity and Leadership Award. And this covers around $11,000. We award this to 3 students each semester or each term when they are admitted. Great. So I'm going to run through the admissions checklist. I'll go through it rather quickly, but again, we are here to answer any questions you might have about the application process. And so essentially, we are accepting applications right now. I'll go over the timeline in a moment. But we do have a few prerequisites. The first is statistics or a college level math class passed with a B+ or higher. Essentially, what we're looking for is quantitative preparation. Brent mentioned your breath courses. Those are the first group of classes that you take when you start our program, one of those being epidemiological methods. And so some of these early courses are very quant heavy, and we just want to ensure that you're set up for success. So, show us that you've passed stats or college level math with a B+ or higher, or show us that you're that you can demonstrate quantitative skills in other areas like your work or any other ways that you may have attained those quantitative skills. And we are looking for a minimum of a 3.0 GPA. This is a campus requirement. It's not specific to our program. If you're worried about meeting either of these prerequisites, don't rule yourself out. Connect with Stephanie, connect with me. We can talk about, again, how to put your best foot forward in the application process. But these are kind of general guidelines that we're looking for. In terms of what you'll submit in your application, so we look at your advanced GPA. That's typically your GPA from your last 2 years of your undergraduate education. And we do that because it tends to be actually a more favorable GPA than your overall GPA. We know those first 2 years are often an adjustment period, especially in undergrad. And so we look at those later 2 years. So we ask that you submit the advanced GPA calculation. We do require 2 distinct essays, a statement of purpose and personal history statement. They are separate essays, though they sound similar. If you have questions about how to distinguish the two, Stephanie and I would be more than happy to answer questions about that. We require 3 letters of recommendation from academic or professional sources. If you've been out of school for quite some time, it is okay to do 3 professional references. That's totally normal. We require transcripts from every institution you've attended. So, if you did community college and then transferred to a 4-year, if you studied abroad for some time, we do need to see transcripts from all of those institutions. We require a resume or CV showing your professional experience. There is an application fee of $135 for US or permanent residents and $155 for international applicants. And if you completed your undergraduate degree in a country where English was not the primary language, then we may require an English proficiency exam, so TOEFL or IELTS. And some very good news is that we don't require the GRE, so you don't have to worry about that. If you haven't taken it, you don't need to take it. But if you did take it and you're very pleased with your score, you're welcome to send that to us and we can take that into consideration. All right, so as I mentioned, we are currently accepting applications for our fall deadline. And so our deadline to apply for fall is March 2nd. If you haven't started your application yet, that's completely okay. I think this is the perfect time. You've got around a month to work on the application, and we even give you a little bit of buffer time after that to submit any missing materials. So you definitely have time if you're thinking of applying. And that March 2nd deadline would be to start the program in August of 2026. If you are just starting your exploration of a public health degree, and that feels too soon. We do also accept applications in the spring. And so you can apply by August 2nd, and that would be to begin the program in January of 2027. All right, so that wraps up our formal presentation. These are the various ways that you can contact us. That's our a direct email address for Stephanie and myself. I see Stephanie just linked in the chat her personal advising schedule, so book a one-on-one appointment. We'd love to talk with you more. And then also some links to other upcoming info sessions we're doing. So with that, let's go ahead and pause the recording and we'll open it up for questions.